Okay. Well, thank you very much again for having me here. And I'm just go on. First of all, I have nothing to disclose, and I just want to say that the opinions expressed in the talk purely represent that of mine and also of the International Society for Nuclear Medicine, and do not represent that of the NIH. And again, thanks for having me here. And thank you again, Dr. Fowler's presentation. He discussed the detail of vitamin C in ARDS and in sepsis treatment. And I want to basically go and some of the preliminary data on COVID-19 treatment in high-dose IVC in China. First of all, let's review COVID-19. And I want to point out primarily that COVID-19 is a respiratory virus causing primarily pneumonia, and some may develop into acute lung injury and ARDS, and there was multi-organ failure and death. Now, I want to point out here that the ALI and ARDS and sepsis are non-specific pathology shared by many pathogens, including COVID-19. This is important is because you don't need a specific drug against a specific pathogen. And if we're looking for a universal measure that will be able to be applicable to many conditions, and that is important. And cytokine storm or increased oxidative stress is the key underlying common mechanism. And then therefore, if we target this pathology, we may be able to treat or manage the condition induced by the oxidative stress, like the virus, bacteria, and other pathogens. And here, let's review. Now, as Dr. Fowler already pointed out, literature is full of studies that shows vitamin C deficiency is a common finding in acute ICU patients. But not only that, also vitamin C deficiency is common in many chronic diseases, including diabetes, cancer, and coronary artery disease. It's a universal finding. Here are some of the literature that says that 40% of ICU patients with septic shock have blood BC levels approaching zero. It's diagnostic of scurvy. We think scurvy probably doesn't exist anymore. However, that may not be true. And with the remainder of those ICU patients may have vitamin C deficiency. Half of the non-septic ICU patients also have vitamin C deficiency. And again, like I said, Dr. Fowler mentioned that low plasma vitamin C levels are associated with more severe organ failure and including mortality. Now, high-dose vitamin C in the literature, there are literature studies that show that high-dose vitamin C can may be able to prevent and improve pneumonia. And in a review study recently, 2-3 years ago, that showed that vitamin C is able to alleviate or prevent the infections from bacteria, viral, and protozoal, and many other sources. Vitamin C cuts the risks of colds by about 50% in physically active and maybe people under stress. Although this point, the vitamin C prevention of common colds in the general population is controversial. And two RCTs in the literature show a dose-dependent response in the therapeutic effects of VC in common colds. 3 RCTs found the VC can prevent pneumonia, that's critical. And 2 RCTs found that VC can improve pneumonia treatment. And there's even 1 RCT found vitamin C beneficial in the treatment of cancer. Now go beyond this slide a little bit more. And I'd like to introduce Dr. Thomas Levy wrote a book titled Tenacious, which actually is a huge review book, not a paper. And VC has been studied and used in clinical management of many conditions. Now, also in the literature, there's a study to show that high dose IVC shortens mechanical ventilation. I think Dr. Fowler mentioned about it in his study as well. Now, high dose IVC shortens patients' time on mechanical ventilation by 14% to 25% when the dose goes out high, to 1 to 6 grams. Now, in my view, personal view, this is still a low dose. Now, high-dose IVC also prevents multi-organ failure. A 2014 study, which is about 6 years ago, reviewed, again, very low plasma PC levels approaching that of scurvy, and HDIVC at a 200 milligram per kilogram body weight, which again is low. It showed a dose-dependent effect on preventing multi-organ failure. Now, I was going to suggest maybe of the following group, but the HDIVC group showed the plasma VC levels of 3 millimole on day 4 on that dosage. Now, I want to give you some perspective. 3 millimole. An average people, for the people in the audience, if you eat a balanced diet, you will be able to approach 70 micromole, which is, 3 millimole is about 40 times higher than that, okay? And 1 millimole is 1,000 micromole. And for scurvy, vitamin C level is less than 11.3 micromole. So high-dose IVC can achieve a lot higher vitamin C level. The first ARDS trial was probably reported in '89, where with 32 patients, divided equally into 2. And high-dose vitamin C group received 1,000 milligram of vitamin C plus NAC, selenium, vitamin E, every 6 hours, which totals to 4 grams of vitamin C a day, which again is a small dose, in my opinion, although much higher than the RDA. And again here, high-dose vitamin C group showed a significant reduction in the mortality rate. And a later study in 2016 by Dr. Merrick, it had a total of 96 septic patients, and many of us are probably aware of this. And again, this study had a daily dose of about 6 grams of vitamin C, and a recovered mortality by about 32%. I'm not going to go in detail of this citrus LI study, which Dr. Fowler just went in detail, but he mentioned particularly the reduction in mortality rate of high-dose IVC, and also the ICU stay. Now, so I reviewed high-dose IVC on pneumonia, on ARDS, on ventilation, and on ICU stay. Here, let's look at the COVID-19. So in Shanghai, as this is going on about 2.5 months ago, right after Wuhan, this COVID-19 outbreak, we started calling for high-dose vitamin C use administration, because we are fully aware of the safety profile, which I'm going to discuss later. Vitamin C treatment is very safe, and vitamin C is very inexpensive. I saw a message in the audience that whether it is ethical to have a very high requirement for IVC use among these patients. I think that's an excellent question, because an administration of high-dose IVC, it can hurt you. It can hurt you. But anyway, here, the preliminary data, again, this is preliminary. So vitamin C has been used in the treatment of COVID-19 infection in China, probably more widely than we expected. And here is a preliminary result from a Shanghai group. So this was done about 2 weeks ago when I talked with the experts in the panel. And out of 358 patients with confirmed COVID-19 infection, about 50 of them received high-dose IVC treatment. And the dosage was roughly about 10 to 20 grams a day. And again, this is a treatment series, not a controlled trial study. And so basically, for moderate cases, they would give 10 grams and every 12 hours. And if it's more severe, they would give 20 grams of IVC a day. And so the impression, again, this is impression. Impression is that the IVC group had a shorter hospital stay, shorter than average for about 5 days. The average is about 30 days, and these people probably about 25. And also, it looks like this group of patients had a faster improvement, and there's no fatality. Again, there was no death in the IVC group. And there's a total at that time, by that time, of 3 deaths of a total of 358 patients. And none of those fatalities received IVC. Now, there was one particularly interesting patient. So this is a senior person with a rapidly deteriorating oxygenation index. And so they decided to give him a bolus of 50,000 milligrams or 50 grams CC on top of what already he was receiving over 4 hours. And it was reported that the real-time improvement of oxygenation index was observed. This kind of corroborates with Dr. Fowler's finding in the first 96 hours of the significant mortality drop in his citrus ALI experience. And so that was the Shanghai experience. And also, I spoke to the world's first high-dose IVC clinical trial in Wuhan. And so this clinical trial is still ongoing, but they have recruited a little over 40 patients, confirmed COVID-19 patients. The good news here is that the COVID-19 infection in China appears to be on the decline, and which is good. The bad news is that this clinical trial, they ran out of patients. They don't have any new patients. Therefore, this trial is being redesigned because they couldn't recruit enough patients. So the preliminary data, again, the data is being finalized and doing the analysis. The preliminary analysis shows that the IVC group showed significantly improved inflammatory markers and the metabolic markers, as well as full organ function tests, like liver function, renal function, these ones. Actually, I'm going to have him on the video conferencing a few days later. Each the people can contact. And so those are some of the clinical trials or clinical management data from China. And also there are other case reports, and I have personal experience as well. I'm not going to go over those. Now, let me suffice to say that the medical associations in Shanghai and Guangdong province, these are two major state level or province level governments in China, and they've seen enough evidence, I guess, is that they have officially included the high-dose IVC in the standard treatment for COVID-19. This is not rumor. This is for truth. For truth. Okay? And I have the reference to it. Now, so we've discussed the high-dose IVC in the treatment of COVID-19 and also on other non-specific viral infections. What I'm more interested in is for the general population. How about oral vitamin C? Any data on that? So let's go to some of the data here. A recent large study actually had, this was reported in, I think it was in February, in British Medical Journal of a South Korean study. This study had 1,444 South Korean army recruits, average age about 22 years. They were divided into two groups. DC group received 6 grams DC daily, which is what I like, and that's what those I usually recommend between 5 to 10 grams a day. After the end of the 30-day training, he also reported a 0.8-fold reduction in the risk of developing TOE. Now, there was a large meta-analysis about a couple of years ago, and which analyzed 29 qualified clinical trials, mostly double-blind RCT. There was a total of 11,306 subjects, and the meta-analysis concluded that 200 milligram daily IVC, which is, daily vitamin C by mouse, which is very low, reduces cold duration in adults by 8%. The same dosage in children reduced the cold duration by 14%. When that dose increased to 1 to 2 grams daily, it reduces the cold duration in children by 18%. And also significantly reduced the severity of common cold, and the results were even better at a higher dose, about 8 grams daily. All right, now earlier there was a larger study having a total of 715 college students. I think this was a Swiss study, aged 18 to 32. They were divided into two groups, the test group and the control group. And so this was actually for two particular goals, I guess. Is that one is that those in the test groups, if they developed the symptoms of a cold, they would be given vitamin C. And in the control group, they would be given, for those who develop a cold symptom, they would be given pain relievers and nasal decongestant. Now, the vitamin C here is 1,000 milligrams every hour for the first 6 hours. So again, that's 6 grams in first 6 hours, then followed by 1 gram 3 times daily. And the author also concluded by the end saying that the vitamin C reduced the cold symptoms by 85%. Now, among those students who didn't develop symptoms, and also the vitamin C 1 gram 3 times daily reduced the risk of catching the common cold. All right. So I reviewed the IVC and as well as oral vitamin C in the fighting or in the treatment and prevention of colds and viral infection. Now look at the safety here. So actually, NIH NCI regularly puts out these PDQs, physician data query, and the most recent one I checked again, it was February. Now vitamin C is very safe at dose up to 1.5 grams per kilogram body weight. Let me translate it into plain English. For somebody who is 70 kilograms, which is only about 150 pounds, not very small, not very high, big in the United States. So for somebody of 150 pounds, that 1.5 milligram per kilogram body weight translates into 100 grams vitamin C per day. Again, put into context, the studies we've been discussing so far use the vitamin C levels in the Citrus Valley, in South America, or in the grams level, less than 10 grams or around 10 grams. And some of them may be 10, 20. So much less than the dosage used here in the cancer treatment. But even at this high level, 1.5 gram per kilogram body weight has been generally well tolerated in clinical trials. So it's very safe. Now, so there are a few cautions when you use the high-dose vitamin C. Renal failure has been reported in very occasional patients, but usually these patients have pre-existing conditions, particularly like a renal failure. Okay. And also, when you use very high doses, particularly above 10 grams or 15 grams, you should screen these patients for B6PD deficiency. And high dose IV vitamin C may also increase the absorption of iron. So in patients with hemochromatosis, you may want to be more careful. And so now we discussed all these and the possible safety profile. Let's talk about the mechanism a little bit. How does vitamin C effect of the viral infection. Again, Dr. Zia mentioned vitamin C has a therapeutic effect. Here we only talk about infection. Actually, vitamin C, my interest has been mostly in the chronic disease mechanism. We're not going to talk about that today. And BC actually, probably as early as 1971, has been proposed by Dr. Pauling. It may be able to prevent and treat common cold. And there are a couple of studies showing that the vitamin C may have a direct virucidal effect by production of hydrogen peroxide via oxidation of vitamin C. Now we all know hydrogen peroxide is a virucidal. It can directly kill pathogens. And vitamin C also has immunomodulation effect. It increases neutrophil phagocytosis and chemotaxis, increases necroplasm migration, affects the production of interferon, and also enhances immune cells like T and NK cells proliferation and modulate their function. And it may negatively affect the replication of virus. And more importantly here, in my view, and Dr. Potter pointed out as well, is that vitamin C is a powerful prototypical antioxidant. It's one of the key molecules in our body's antioxidant systems. And it can protect our cells from oxidative damages during infection, from increased oxidative stress. And I think this is the key here, is that this is the key to prevent particularly COVID-19 patients from deteriorating into pneumonia, ALI, ARDS. So we need to use the early, and we all know, 1 month per month prevention is worth key. So this is key. I think we all agree on that. Now, the European Food Safety Authority, the EFSA, already concluded that as early as in 2006 that there is a cause and effect relationship between dietary intake of VC and the contribution to the normal function of the immune system. And the EFSA further in 2009 concluded that in persons exposed to severe physical stress, it has been also established that their regular BC intake above 200 milligrams per day exerts a cause and effect relationship between the protection of DNA, protein, and lipid from oxidative stress, and also normal collagen formation, normal function of nervous and immune system. Again, this collagen formation, we haven't really discussed much, but collagen formation is very critical also in the protection and the prevention of pathogen or maybe even cancer spread, because collagen is a key ingredient of basement membrane and in a lot of our system. And unfortunately, we don't pay much attention to collagen. Now, in summary, I think there's enough evidence here to show that a percentage of COVID-19 infection may develop into pneumonia, ALI, ARDS, and death. And ALI, ARDS are non-specific pathologies caused by cytokine storm, which is the same as significantly increased oxidative stress. And high-dose vitamin C has immune-boosting effects and probably direct virucidal effect. And the HDIVC seems to prevent pneumonia and reduce pneumonia severity. And HDIVC seems to improve ARDS and sepsis and may reduce ARDS sepsis-related mortality. And HDIVC is safe without significant side effects in doses up to 1.5 gram per kilogram body weight. And that dose, again, is used, the dose is used for pneumonia, ARDS, are much lower than the doses used for cancer. So HDIVC is a very promising non-specific antiviral as well as therapeutic agent for oxidative stress-induced ARDS. So given the safety profile and its non-specific antiviral effect and its role in oxidative stress-induced ARDS, and also widely availability and low economic cost, I really feel that further research is warranted to establish, hopefully once for all, as vitamin C is a normal, is a universal and a non-specific agent in the prevention and treatment of COVID-19 and the future epidemics and pandemics. Here I want to add, every time a major epidemic or pandemic breaks out, we panic. And we panic in SARS, we panicked in MERS, we panic in many other Ebola, these Marburg, and then we're panicking in COVID-19 again. And if we don't have this universal non-specific therapies in place, next time one epidemic happens again, we will panic again. Hopefully, this is something good out of this very tragic pandemic that we're experiencing right now. Hopefully, next time we won't have this. Problem again. Now, again, this is my personal opinion. I asked in my recent article in the Journal of Medicine and Drug Discovery, which is a journal by Elsevier, the title is 10 Early and High Intravenous Doses of Vitamin C Prevent and Treat Coronavirus 2019. My answer is yes. An early and large dose vitamin C is the key to prevention and treatment of COVID-19. But I didn't discuss many of the personal anecdotal cases which I had, but I'm not going to go over here. Now, finally, I'd like to thank many of my colleagues and co-workers here, and I'm not going to read all of them. The names are listed up there. And at the bottom of this is I particularly want to thank the International Society of Molecular Medicine and its Medicine News Service Board, because they have been of tremendous help in going over the PPT and discussing all these with me. And I owe them tremendous. They've been very selfishly, tirelessly promoting and educating the public environment. And thank you again, and thank you, Dr. Shi, Dr. Zia, and Dr. Moody, and others for inviting me on this. And this is my last slide. Yes, Dan, I'm finished.
Yeah, okay. Thank you very much for the doctrines, the wonderful talk.